Welcome and thanks for joining us for today's ASA webinar, Fall Prevention. We will be getting started in just a few moments from now. Today's webinar is part of the Family Caregiver Support Series sponsored by Home Instead, Inc. The next presentation in this Family Caregiver Support Series is November 4th, 2020. Visiting www.asaaging.org/webinar seminars for more information. The slides for today's presentation are available under the tab marked Resources. Under the tab marked CE Application here contains information on how to obtain CE credit for today's webinar. You have 60 days to complete a continuing education application for today's webinar, and it may take up to 30 days for the date of your application in order for us to process and issue your CE credit. If you are not logged in directly to this webinar, that is, if you are watching as part of a group and did not log in using an individual confirmation URL, you will not be eligible for continuing education credit because we have no way to track your online attendance. If you'd like to receive continuing education credit, please be sure you log in using a confirmation URL you received after individually registering. If you have questions during the presentation, you can send those anytime using the questions box, and we will save those for the last 15 minutes of today's program. And now we would like to welcome today's presenter. April Ibarra is a dynamic leader with over 25 years of experience in healthcare and aging. She is a strategic accounts manager at Home Instead Senior Care and supports the organization's mission through collaborating and creating partnerships that develop impactful relationships for the Homestead Network. April?
Good afternoon, good morning, wherever you are, hello. And I'm going to assume I'm loud and clear and you all can hear me. Thank you so much for joining me today. There's so much going on in the world right now and so many important topics. So for all of you to join to talk about something that really has been discussed so many times, but is still a really, really vital and important subject. So today we're talking about fall prevention. Again, it's not a very glamorous topic, but things have not changed in relationship to what's happening with our older adults. So it is important. I'm glad you're here. So we're going to jump in and get started. So let me get my slides moving. All right, you know a little bit about me, and essentially I've been talking about fall prevention for, 20 years. It's something that I've always been passionate about. Throughout my career, I've observed so many situations where the fall really impacts that older adult. So I get pretty excited about it, so bear with me, and I hope I'll get you excited as well. So our objectives for today are to discuss the signs that an older adult may be at risk for falling. So obviously we need to understand what the risk factors are, but we want to be able to reduce the risk of falling. So we're going to talk a lot about that. And then we're going to talk also about some home safety and what we can do to reduce the risk of somebody needing more care and having to go to the hospital. So lots of good things to talk about. Of course, we're going to start talking about statistics. Statistics are not what drives my motivation, but it's important as a reminder. What's really going on out there? I know we all have personal experience. Everyone on this call can share a story of a client, a patient, a loved one, a family member, someone who's had an issue related to falls. It goes across the board. So I don't know what you think about when you look at these statistics, but I think about those people. I think about what's really going on in their life and how traumatic this can be for them. But it's important to recognize that falls are the leading cause of fatal and non-fatal injuries. So, we're looking at so much going on in the world related to older adults now with the COVID pandemic, with isolation, with disconnection. We could forget about the impact that a fall could have. So again, thank you for joining me today to talk a little bit more about this. I think the most significant thing for me about these fall statistics is the fact that it changes the lives of the older adults. When they have a fall, when they start to fall, it's not always that serious injury, that 1 out of 5. They don't always end up in the emergency room, but sometimes people die as a result of the fall. And more importantly, it's what happens to their psychology. It's what happens when they become afraid of falling, and they really start to limit their activities. And you can start to see a change in behavior. So again, statistics are important, but what does that mean? What is the impact of the fall on the older adult? And I have a feeling most of you on this call really have some experience in talking with your clients and patients and people that you deal with about what it means to them. So we'll dig deeper here and see what we can do to prevent these falls, because we do have opportunities. You know, I was always convinced that when we start to talk about the cost financially of falls, that it was really going to start to make a difference in how we approach this topic and maybe what resources were available. But I'm still not seeing it, right? Again, this year has really impacted so many and sort of diminished so many other things that we've been thinking about, such as fall prevention. But it is expensive. There's the financial cost, but then there's the emotional cost. But we know the healthcare industry is really struggling to deal with managing so many of the costs associated with older adults, and falls are very costly. So that's something to keep in mind. One of the great things, though, to me, is there are some things that we can do, and that's really what I want to focus on today. There are some ways to prevent. We know that it's common, but I love what they're doing through the STEADI program, which is actually stopping elderly accidents, deaths, and injuries. And providers, healthcare providers, are playing an active role right now in trying to address this topic. And I have to say, I was at an orthopedic office personally this week. I have aging arthritic feet. I was in for an appointment, and I got to hear the providers talking with these older adults as they came in. I believe they asked me the same question, but they're asking, have you fallen in the past year? Do you feel unsteady when standing or walking? Do you worry about falling? So the providers are starting to address it. Now, my question is, all right, what happens when that older adult actually says, yes, I have fallen. Yes, I'm unsteady, and I do worry. My question is, what do they do with that information? But I'm glad that they're asking. And certainly, if you've been in any kind of a doctor's office lately and you're around older adults who are in for their appointments, you can see the frailty and the challenges that they face. So it's good to get those healthcare providers involved. We know that, there's so many people impacted, but the fall, again, once somebody falls once, it doubles their chance of falling. And again, my biggest concern is here, what does that do to that older adult? Do they start to limit their activities? It's not always an injury that happens, those things that we are most concerned about. The hip fractures, the broken bones, the head injury, those are the worst case scenarios. But many times it's a fall, they're on the floor, they can't get up, it starts to really change how they look at their aging experience, and it starts to limit their independence. And why? Because we know that 40% of people hospitalized from a hip fracture do not return home, are not capable of living independent again. So they see this happen to their friends. They're concerned that if they have a fall again and they're older, or their family finds out, that they're going to be concerned they can't live on their own. So all kinds of things happen there in the older adult's mind. So it is tough. And again, the things that I've heard across the years with falls just blows my mind. Again, not those injury type things, but someone who was trapped when they went to the bathroom and fell and was, stuck between a radiator and their toilet overnight until their daughter came the next morning. It just goes on, and I know you know those stories as well as I do. And we know there's an impact to the caregiver. Let's face it, our caregivers are really on the front lines with older adults. It's it's so difficult now when there's a limit to people's ability to connect and see their families. But the caregivers do have a lot of burden. They're concerned. What is this going to mean now that mom is starting to fall? What's going to happen if she can't get help? What if she can't stay at home? The caregiver really has a lot of burden, but also a lot of opportunity. I'm so interested in trying to get everyone to talk more about an aging plan because unfortunately, and I know you see this, in your day-to-day activities in your profession, there is no plan. We don't talk about what's going to happen with the aging experience because it's uncomfortable. We have to talk about it. When we're in crisis mode is the worst time to start making decisions on what's going to happen. So again, this is my opportunity to kind of get on my soapbox there about really helping to prepare and talk about things within the family about, what to expect in the aging journey. We've already talked a little bit about this, but again, I think it's important to know because the more that we can keep somebody from falling and from having these injuries, it's going to reduce the cost to our healthcare system. Heaven knows what that's going to look like in the future. But as we have more and more aging people, the average hospital cost for a fall injury, $35,000. That's a lot. That's not as concerning to me, though, as this psychological impact, that fear of falling, the fact that they limit their activities, and this just creates what we call that downward spiral, right? I'm sure you see it every day with some of your clients. And when somebody's afraid to fall and they stop doing the activities that they do, that decreases their physical capacity and it also increases their risk of depression, isolation, and feeling of hopelessness. So, let's avoid that. Let's do what we can to reduce the risk of falling. And there are things we can do. So in order to reduce the risk, we have to talk about what are the risk factors. This is where it gets a little complicated, right? So, as we start to address the risks, it's so multifactorial. That's what makes it complicated because it's not just one thing. You've probably heard somebody say, well, I don't know if I broke my hip when I fell or I fell and broke my hip, right? Because what happened first? So that's what makes it difficult, and it's usually not one thing. The more risk factors we have, the more likely we are to fall. So in order to reduce the risk, we have to address the whole picture. What are all the risk factors and how do we address them? I say address them, but remember, we're not in this alone. We can try to educate, encourage, inspire, motivate, inform older adults, but they have to be on track, with this plan. So how we approach it will really make a difference. And we'll talk a little bit more about that. But again, the different forms of risk factors, intrinsic, which are things that are commonly age-related changes, right? Things, I don't like to say normal aging because I don't like that term. Everybody ages differently. And so, but there are things that happen as we age that can increase our risk. We'll talk more about that. The intrinsic factors, the extrinsic, is more about the hazards, right? What is going on around the home that could be a risk factor? And then I think it's important to think about behavioral risk factors because people sometimes choose behaviors that we know are risky, such as, climbing on the roof to clean out the gutters. And I say this because I'm looking across the yard at my neighbor who is older, who gets up on her roof, and I take pictures of her, and, she's quite comfortable with it. But that's a little bit of a risky behavior, and, But remember, people have to make their own decisions. But we sometimes continue and make things that could be risky that maybe could be avoided. So let's dig a little bit deeper into these intrinsic risk factors. And right on top is one of the top ones that really, if we can make an impact in this, we're going to help to reduce the risk, and that is polypharmacy. I would love to hear from you. What is the highest number of medications you've seen your patients or your clients on? We know that on average, I believe it's about 5. We know that many people are on more. And this is one of the top things that we can address by reviewing the medications that an older adult is on. This is complicated. It's challenging, but it's vitally important. And many people are on the same medications, perhaps that they've been on for years, and they're not really considering, gee, do I need this medication anymore? Or does my body respond differently to this medication? Because as we age, how we metabolize medications is different as we age. So there's a lot around polypharmacy that's important. So I encourage everyone to find out in their communities and make recommendations on having those medications assessed, screening for medications that may increase risk for falls, assessing the needs of these medications and the health conditions, looking at the formulation. Can we look at a lower dosage? Can we look at a different medication? And then educate and talk. So this is really important. Other risk factors we've already talked about, previous history of falls. It's evidence shows that once you start falling, you're likely to fall again. And so what can we do about that? Address all the risk factors so we can minimize the number of falls that person has. Not all falls can be prevented. Let's face it, falls are accidents, but as we age with all these risk factors, there are things that we can do to risk, but we can't always prevent every single fall. Muscle weakness. I started, one of my first jobs was, I was 18 years old teaching an exercise class in a nursing home, chair fitness. And I did that for probably about 15 years throughout my life, teaching exercises. And it's still one of my, again, I get on my soapbox about this, but I would say to the participants in my class, how many of you want to get help, want to have someone help you get on and off of the toilet as you get older? No, you can imagine what they looked at me like I was crazy. And I said, the fact that you need help or that your muscles are weak is not necessarily age related. You can strengthen them. Simply, doing chair sits and, getting up in between TV programs or whatever, there's lots we can do to focus on muscle weakness. And so, exercise. We'll talk a little bit later about some of the exercise programs that are out there that are evidence-based, great programs. The issue that we're having with those now is they cannot be conducted because of COVID. So, maybe we can explore and get creative on some things with there. Other intrinsic factors, gait and balance, of course. What is gait? What is balance? Obviously it's the ability to walk without issues. It's the ability to stand and navigate. And with age, of course, we have many different things that could impact that and become a problem. There are a lot of medical conditions that are associated with gait and balance disorders, everything from, depression. People don't often think about that, but how many of you have seen, people who are depressed, their whole demeanor and their body changes, cardiovascular disease, metabolic diseases like diabetes, obesity. There's a lot of medical conditions related to gait and balance. Poor vision, that's an obvious one, but sometimes just being able to address and make sure that they have, their glasses are clean, their glasses are up to date, they have glasses, they have a way to see. Again, if you can't see very well, likely to trip over something or have an issue. I'm somebody who wears bifocal contacts plus readers, so I get that. I know that I feel uncomfortable when I don't see well. Postural hypotension is another risk factor, and again, that's when standing too quickly causes the blood pressure to drop, and that's always an issue, and especially when older adults are get up in the middle of the night to go to the bathroom, they stand up quickly, they have some urgency. There's an opportunity there for that to happen. So, educating, talking about these risks, helping them to understand. We also know that with chronic health conditions, that increases our risk. Arthritis, strokes, incontinence, diabetes, Parkinson's, dementia. Again, not all normal parts of aging, but more older adults are prone to chronic health conditions. These will have an impact. The extrinsic risk factors are a little more easier to observe, right? Those environmental hazards in the home. And boy, is this a challenge. I would love to hear from some of you who, are working with older adults in their homes and how you observe them navigating through their home. Between the obstacles and the tripping hazards, dim lights, lack of stair rails, grab bars, all that stuff. We'll get into a little bit more detail, and I'll provide you with some great resources. But home safety is important, so we do have to address that. And then we have to, recognize that many times we get assistive devices to help with the gait and the balance, such as a cane or a walker, but they don't quite know how to use them, and that can create a risk. So those are examples of those extrinsic risk factors. And then along the behavioral risk factors, again, I don't think we think about these that often, but you may or may not know this, but older adults do drink alcohol and they do use drugs. And I think it's important to recognize that. I've observed that so many in some of the clients that I've dealt with in the past. If an older adult was used to their, martini after dinner, that's a habit that they've had for years. It's part of what they love. And they're still drinking that 1 or 2 martinis, and they're on 5 medications, and they have these chronic illnesses. They're metabolizing that alcohol much different. So we have to recognize that, these things do have an impact. We've already talked a little bit about drugs, but we know that, just even prescription drugs can have a big impact on, on their risk for falling. Other things too is just not acknowledging the risk for different things that they're doing, right? So I'm still going to clean my windows. I'm going to get up on the ladder. I'm still going to wear the high heel shoes because I grew up as a woman who loved to have that persona, and I'm not going to stop wearing those. So those are some of the behaviors that could put them at greater risk, and we'll talk a little bit about how you talk about these things as we go along. First, when we're talking about helping older adults to prevent falls, has to start with a healthcare provider, right? Because many of these things, as we talked about, many of the risk factors are related to what's going on with their health status, the chronic conditions, the medications that they're on, the fact that, they have muscle weakness, all of these things. If we start with the healthcare provider and talking about the concerns, they can start to guide and direct the older adult through some resources that are available. So that's the best way to start. I would love to hear how some of these conversations goes. We've all been at the physician's office when there's so little time, so I think it sounds good on paper. But again, it's up to the older adult and perhaps their family caregiver, if they go with them, to really address the concerns and be prepared to talk about them. If the healthcare provider doesn't know these things are an issue, how can they make some recommendations or provide interventions? The medication list, get those things reviewed, ask for referrals for the vision, the hearing, occupational therapy, so that we can assess and again, look at the risk and provide appropriate community resources. Again, sounds great on paper. I'd love to hear how that's going for many older adults, but it is where we need to start addressing the issue. The medication review, again, this is important because we've already talked about some of the risk factors associated with the medications. And, maybe it's not the physician who's going to be the best person to do this. Maybe it's the pharmacist. I hear more and more about the role the pharmacist has in really communicating and understanding and helping the older adults. Sometimes we need to stop medications if necessary, switch to other safer alternatives, reduce the risk. And it's no surprise the common side effects include unsteadiness, impaired alertness, dizziness. Well, yes, those things are going to make somebody at a greater risk for falling. It's hard to imagine, but still there are so many medications that are subscribed to older adults or prescribed that they should not be on based on the American Geriatric Society BEERS criteria. And I know we're looking at our 2021 schedule next year. We're really going to, I think, talk about this subject because I think it's important to understand the medications that do cause a greater risk for older adults. And we have to recognize not all physicians are really going to be experts in what's vital or what's important or what, for older adults. So, opioids, sedatives, antipsychotics, antidepressants. I know my own mother was on multiple medications, especially for depression and anxiety. And those really did put her at greater risk. And it took us a long time to get some of those situated. So again, if there's one thing that you can encourage your clients to do, I would say it's review their medications and have some assistance with that between the family caregiver and whatever services you provide. And then, hey, next, I would say let's exercise. Again, it's my passion, it's my soapbox, but increasing the strength and balance have been proved to be very, very effective. And there's so many things that older adults can simply do in their home with the encouragement of their caregiver or their healthcare provider, and just keeping them active and moving. It doesn't have to be, a strict exercise program, but any movement, walking down to their mailbox, as simple as that. Getting up, in between TV programs and doing some leg lifts and some calf raises. There's a lot of things we can do, but being sedentary is definitely a risk for older adults. Physical therapy interventions are a great place to start because they can really assess and evaluate, what is going to be appropriate for that older adult. So I would absolutely encourage asking for an assessment by a physical therapist so that they can really work on those standing balance and strength exercises, how to transfer, gait interventions, how to use those assistive devices successfully, and also addressing techniques for getting up after a fall. Because remember, not all falls can be prevented. What happens when somebody has a fall? Let's address that. I mentioned earlier evidence-based fall prevention program, and there's a few on here that really, really offer some great things because they're not just exercise, it's addressing the entire scope of the risk factors. Because remember, we have to address individual risk factors in order to reduce that risk by eliminating or reducing the risk factors. And again, it's that multifactorial approach. It's addressing as many as we can so that we can start to minimize their risk for falling. Again, the issue with some of these programs now is many of these programs were community-based exercise programs where the older adult would sign up for a 7 or 8 week series, and they would be around, connected with other people, which again is great value because we're clearly concerned about social isolation amongst our older adults. So I think exercise programs are great, but obviously many of these are on hold now, which is an issue. But you can still go online and look at many of these programs. And I looked at the Otago, if I'm saying that right, and that's a specific program that there's like about 17 exercises that are delivered by a physical therapist, typically in the home. But you can go online and look at some of these exercises. And again, we're not talking about squats and lunges and, weight training. We're simply talking about getting up and out of the chair. We're talking about practicing walking, sitting to stand, sideways walks, heel toe walks, one leg stands. There's lots of things that people can do in the home with some supervision or maybe with some encouragement from family. So it's not ideal, but it's still available, and we have to talk about it and make sure that we encourage our clients and our family members to do these things. There was something else I was going to say about that, but I can't. But I do love them. I know for years, as I mentioned, I taught exercise programs. And again, just going back to that social thing, I taught retirees for General Electric for about 15 years, and just the camaraderie that these folks had together. So I'm hoping when we can all get back together, we can encourage and get these exercise programs started again. Vision and hearing, again, these are common changes that older adults have, is declines in their vision and their hearing. So easy enough to schedule regular eye exams. Again, ensure they have the most current prescription, be aware of changes in visions, consider surgery if it's necessary, if they're having issues, and encouraging them to have their hearing tested and wear hearing aids. So those are some very easy things that we can do. All right. Excuse me. Got a little dry throat there. Now we're coming into some, more things to talk about. I apologize. The home safety. Again, now this is a very broad topic, but I think anyone who's in the home of an older adult can make a pretty quick and easy assessment of what's going on at the home, what the risks are, and be able to identify those for those older adults. Let me get a little water here. Getting all excited on this subject. So there's a couple of rooms that are, again, where it's more common they're going to have those accidents, and those are, no surprise, bathrooms and kitchens, traditionally where people spend a little bit more time. This is where it gets tricky, because everything that we're talking about here in terms of those safety considerations, rugs, lighting, grab bars, pets, pathways, everything around the home, we can't go in and make these changes without the consent of the older adult. We have to engage them in everything that we're doing. If you want the intervention to be successful, we have to engage them. That's tough, right? We can't just go in and say, you know what, this rug's got to go. You've tripped over it twice. It's out of here. Well, Aunt Betty's had that rug for 30 years, and she's not going to have anything to do with that. So, we're going to talk in a minute about communication and how to address these things. But essentially, we have to get them to understand what are your goals, right? And I think it's always important to start with, tell me what's important to you. Well, I don't want to fall again, and I don't want to have to end up in the hospital and maybe in a nursing home because I've had another fall. All right, then what are you willing to do? So you love this rug. How important is it to you? That's a great way to start that conversation. I understand that, you had an issue the other day in the bathroom and you didn't have those grab bars. Do you think if you had them, you would have been able to help yourself up, and then, Uncle Ned wouldn't have had to come over to get you off the toilet or out of the bath? Yeah, that would have been good, right? So you're putting it back on them to make the plan and have it connect with their goals. We have a great resource. Again, there's so much information out there that's available to you to help your clients. Making Home Safe for Seniors.com is a great kind of virtual program where you can actually walk through each room of the home and kind of take a look at what are the risk factors, what are we looking here that may be present a problem. Everything from, lighting to clutter to trip hazards to, one of my favorites is, you have to go all the way across the room in the bedroom to turn the light on. Well, what's going to happen when I trip over, the cat because I didn't see it because the room was dark. So lots of things we can do around the home. And again, we're going to start by engaging the older adult in the change. And I think this is a good place to talk about the stages of behavior change, because remember, we can't do this for the older adult. And I am a social gerontologist, so I come at everything from the aging perspective. And so I think it's important that they determine what they want. And that's tricky, right? Because we all want to advocate and care for older adults. We're concerned for their safety. We want to intervene, but we also know that many times they get very, very reluctant to change or talk about anything. And that's frustrating, right? I know many of you on this call have been frustrated with having this experience with your, with your aging clients. But we have to kind of look at the big picture. Why are they having this behavior? What is behind? There's always meaning behind the behavior. So if they're reluctant to address or to make a change, why do you think that is? And again, let's talk about it. So if they are not in the right mindset, according to the stages of behavioral change, they're probably not going to be very likely to comply with that, especially if the family or a healthcare provider is coming in and saying, this is how it's going to be, you're older, you're at risk, this is how we're going to handle it. I think you can all imagine that just doesn't work. So let's look at these stages. Pre-contemplation is they're unaware of the problem at all. I am not at risk for falling. My neighbor is falling. I don't see it happening. I'm not worried about it. So if you start to talk about some interventions like, hey, Mom, let's get you a medical alert, or hey, Mom, let's start to look at your home and make sure it's safe. If they're in that pre-contemplation mode, they don't even know there is a problem. So plant the seed, right? Most of these conversations are not going to happen in one quick conversation. We have to plant the seeds and get them thinking on their own, is my advice. And then we go up the ladder here. Contemplation. They're aware of the problem and they may have a desire for behavior change, but they're still kind of thinking about it, right? Yeah, I had an issue last week and it did concern me. I'm wondering if it's time to add some assistive devices in my bathroom, or maybe it would be nice to have someone come in and help me around the house every once in a while. So that's contemplation. Preparation means they are ready for action. They are concerned. They feel it. They're going to be really, on board with changes. Right? And action is, they're in their desired behavior, they're doing things about it, and maintenance, of course, is keeping them there, sustaining that behavior change. And maybe that's doing their exercises. Maybe that's not getting up on the ladder and doing their own windows, but asking for someone to come over to help them. But we have to remember, older adults, let me rephrase that. Older adults are adults who are just older. They're no different than any of us. So why would they be comfortable with relying and needing and asking for help? So we have to remember that as we approach them. And I believe independence and allowing them to think on their own and make decisions with our encouragement and education is important. Now, that's considering everyone is cognitive and able to make decisions. So obviously we know that there are older adults who have cognitive changes and they're not able to think clearly and make these decisions on their own, and they could be at risk. So please don't misunderstand what I'm saying, other than if that older adult has the capacity to make decisions and they're of their own mind and body, we have to guide them. We cannot make these changes for them because it's just not going to work. I think it's important to, again, address the fact not all falls can be prevented. Phillips put out a great resource years ago, How to Get Up from a Fall. And I did this presentation many, many times with older adults. It's a lot of fun. And again, you address the fact that if what would happen if you had a fall and you could not get up? Ask that question. So would you be prepared? It's just like a fire drill, just like planning for anything else, any other emergency. And this guide really walks them through, instead of panicking, how to roll onto their side, how to push themselves up as best they can using, a chair or something around the house. And then I think talking about what is going to happen if we don't get help quickly. And those consequences of a long fall are some of the significant things we talked about earlier. And you've heard them, right? You've heard all these stories where somebody has been on the floor, or I've also heard in the bathtub. They didn't fall, but they just couldn't get out of the bathtub for hours and days. So we're talking about pressure ulcers, rhabdomyolysis, hypothermia, dehydration, and death. So, if we can get them up and get them help quickly, the outcome is going to be so much better. Let me just go back and say one thing here about, medical alerts have been around for years. Again, we're looking at Philips Lifeline, and a lot of has changed in technology. There's a lot of great things out there. As a matter of fact, I just looked, Amazon Alexis has a device that they're rolling out that will call for help if they sense that there's something going on. So it's not always just wear a pendant, push it for help. There's a lot of technology that's available out there that can help the older adult if they've had an emergency and need help. There's a lot of great things because falls happen everywhere. Excuse me. We're talking predominantly here about the falls in the home, but we know that falls in institutions such as hospitals, nursing homes, are a big issue. And there's so much advanced technology out there that's available that really just helps to alert if there is an issue and get help quickly. So the technology has improved. I think it's still really important for everyone to know what would happen if you did have a fall and you couldn't get help. What is our plan? So I think that's just really important. Again, a lot of good resources out there. I hope we've included many things for you. I hope that I've covered so many things. I've talked so quickly. I'd love to hear from you, so I think I'll stop and pause and see what kind of questions, and I would love to hear from you.
April, thank you so much for the presentation. We do have some questions for you. One being, where do we get a list of high-risk medications?
Yeah, I would suggest the Beers list that is referenced in here would be a great place to start. Also, the CDC has some really, really good handouts. So I would check out the CDC, but specifically for the high-risk medications, I would check out the Beers list.
Awesome. And to your knowledge, are primary care physicians and geriatric providers with information about STEADI, STEADI, and what steps they should take if the older adult patient reports they have fallen?
I love that question because I asked that myself. I would need to dig into that. I've observed it, as I mentioned just this week. I was at the orthopedic office and I heard them asking those questions. But again, those questions were asked as that patient checked in, right? So they're standing in the lobby. You've got, there was a lot of people out there. We all got our masks on, and that healthcare provider is asking those three questions, right? Have you fallen? Are you unsteady? Do you worry about falling? Where does that information go? I think it's a good start, but I'll be honest with you, I am not 100% sure, and I would love to find out. So maybe I'll take that as a takeaway to follow up on.
Awesome. Can participants find these resources in different languages?
I would imagine so. I'm not specific what resources they're asking about, but I think everyone is doing a great job of making sure, understanding that there's many different languages that we need to provide these resources. So I don't know specifically what languages they may be looking for, but I think, especially when it comes to the information that the CDC offers, I think many of them do.
Okay. And what is rhabdomyolysis?
Oh gosh, that's a good question. It's been a long time since I went into the detail of that, but I can't remember. It happens when somebody has had a fall, and I believe it's something that happens to the kidneys. And I apologize, it's been a while since I've addressed that, and I'm not the clinical expert. But what happens after a long lifetime is it's something related to kidney failure. Right? And it causes some severe complications. That's the best that I can describe it. Again, it's something that really can't be seen. Most times people don't know they have it. And if they do go to the ER, a lot of times they will find that issue and address it, because if it goes unchecked, they could go into liver failure.
Okay, thank you. Where can we find more about technologies that are available for the home?
Yes, there are some great resources out there, and I have to say it's mind-blowing, some of the things that are out there now. My favorite go-to is a blogger called Lori Orlov. Last name is spelled O-R-L-O-V. I don't have her blog name right on the tip of my tongue. Let me look it up here. I think it's the Aging Technology. Yeah, Aging and Health Technology Watch. I love how she takes information and makes it available based on, what the person is looking for, what type of device, and so she does a great job. I think it's a great go-to resource.
Thank you. What if the fall occurs outside and there is no chair for the senior to get onto and sit upon until feeling stronger?
Sure. Yeah, that's a good question, because obviously we want our seniors to be up and moving and active. And that was one of the beauties, I think, as the medical alert industry advanced. They now have GPS devices, because let's face it, you would hope if somebody had a fall and they were out in the community, somebody might see them and help, right? But I have to say, I fell one time at the airport in Maryland. I can remember this so clearly. I had a really severe fall. Not one person came over to check on me. So, you never know. But you're hoping when you're in the community. But I think still teaching them how to get up from a fall does help, because even if there's not something to push up on, what you don't want them to do is try to pull themselves up with the weakest part of their body, which would traditionally be their core. So rolling onto their side and trying to push themselves up from that position is going to be better than just trying to, again, kind of use momentum to pull up from your core. And I think the GPS mobile devices are great because, again, if they're at the park, if they're in the back of a grocery store and they push that button, help can arrive. And if they can't get up, somebody can come to help. So I think that's a great option.
Thank you. What does STEADI stand for again?
Yes, that is, let me get my glasses on here, stopping elderly accidents, deaths, and injuries. And I believe it's a CDC program. It's tools and resources that can help you screen, assess, and intervene to reduce your patient's risk of fall. So it's really targeted towards healthcare providers such as the family physician, internist, that type of thing.
Okay. What's the best or most recommended fall assessment resource for a layperson?
That's a good question. Gosh, there's a lot, and I don't know if I included that in here. And my contact information is in the PowerPoint. I would encourage you to reach out to me. I know that there's so many of them out there, and I don't know if I'd recommend one or over the other, but I think if you Google that topic, you're going to find a lot. Or feel free to email me, and I can do some research and send you what I think might be appropriate. But if it's for the older adult, it's again getting them thinking about their own personal risk and what they're willing to do. So it's going to probably go through and ask many of the questions about their risk. Right? So you want to look at something that's going to go through and present many of the risk factors that we talked about, including intrinsic, extrinsic, and behavioral.
Thank you. Are there any SAIL classes offered online in the Northern Virginia area?
I looked quickly yesterday, and all of those activities right now are on hold. From the best that I can tell, I did like that particular program as well, but I think right now they're all on hold because, traditionally they are, an attendee type program, and they just haven't figured out a way to do it virtually. But definitely check it out because I could be wrong. And, I encourage, again, that exercise part, I think there's many of these, there's trainings on how to be a teacher. So the more of us who can get involved in our communities and learn how to teach some of these programs, the more impact we're going to have.
Can you recommend some Canadian fall prevention programs?
That is a very good question as well. You know what? I will have to do some research on that. I don't have anything in front of me that really addresses. I would imagine there are some very similar things, but if whoever asked that question, if you don't mind sending me an email, I will explore that. And again, the email is in the PowerPoint, but it's april.ibarra@homeinsteadinc.com. Happy to help you find these resources.
Thank you. We have another question, just asking for recommendation on how someone can be encouraged to remember to use a medical alert after a fall, as well as agreeing to having medical follow-up after the fall.
Yeah. So this is where I always, because I actually worked for Philips Lifeline for many years. I've worked in all aspects of healthcare, and this is a question we get a lot. Essentially, it always goes back to me to what is the goal of the older adult, right? Many times, an older adult will get a medical alert because the doctor says, please, mom, it'll help me, it'll make me feel better. So there's a lot of reasons why they might get it. Might not have been their original choice. However, I always say, tell me what your goals are, and if they say to me, well, I don't want to, I don't want to be a burden to my family. I don't want to end up in needing more care. I want to be able to stay in my home. All right. What are you willing to do to achieve that? Would you be willing to keep this medical alert on you and use it as you need it, right? So helping them to understand this is a tool to help promote their independence and help them achieve what they're looking for. It's not to take anything away from them. And then I think you had a follow-up question about if they need more help or follow-up. Could you repeat that again?
Yes, they were just wanting to know how to encourage them to also get checked up for after the fall.
Yeah. And I think it's talking again about maybe mentioning some of the things that do happen after a fall, especially if they didn't get help right away. So talking about those things that can happen. And again, it's all about, well, we want to be cautious because we want you to keep living the life that you want. So it always goes back to the older adult and what they want to accomplish.
Thank you. And we had another question in regards to remodeling of a senior's home. Oftentimes they are reluctant to remodel their home just because they don't want it to look like a hospital. Do you have any recommendations on if they should go with an interior designer who is CAP certified or like specialists who
Yeah.
can interrogate?
Yeah, that's a great question. I'm actually CAP certified myself. So, I think it depends on, first of all, budget. When you talk about this is one of the, kind of interesting things about the home, right? We know that seniors want to age in place. All right, what are the barriers? And what is the budget? If you live on a two-story home and your bedroom and everything is up on the second floor and you can't ambulate up there, what is that going to look for? And again, that goes back to planning. If we can start talking about and having the conversations and planning for the aging experience, that includes, cost, realities, needs, desires, all of those things. I think it's good to involve a professional. There's been a lot of improvements in terms of design. Again, I think that can be addressed, right? Because essentially your home is your place where you love. What can we do to make it accommodate you so that you can stay here? Again, going back to their goals. But there's a way to do it without making it look like a hospital, certainly. And I think CAPS is a great place to start, and working with people who are experienced in design and also safety. But again, with that comes a cost. So it depends on budget.
Awesome. And we have a follow-up question to the question regarding the fall occurring outside. Can you provide recommendations on how to assist someone that is in a kneeling position to a steady standing position?
Well, that's a good question because, even a lot of people, even healthcare providers, are not able to assist people up, right? I don't know, without knowing the circumstances, I don't know that I would encourage you to actually get that person up. Maybe, maybe you're at risk for hurting yourself. Maybe you're at risk for hurting them. So maybe it's calling 911. So that's kind of it's a hard one to answer without looking at all the circumstances, but obviously acknowledging that person has had an issue. But you also want to protect your own health. If that person maybe is larger than you could accommodate, call 911, have EMS come to assist. That's a good question, though.
Thank you. And we have just one more question in regards to the remodeling. Are there any financial assistance with remodeling for someone who does not have the money?
Yeah, I think that would depend on the community where you live and what resources might be available. I don't think I could answer that, in general across the country. So I would, check locally with area agencies on aging. I think there are many places who have had grants and, can certainly accommodate some things, such as, especially when somebody's coming home and now they're in a wheelchair or and they can't get up their stairs. So I think there are some resources locally to support those types of things. But when you're looking at an overhaul of your home to really come in and make it safe, maybe not, but definitely for those people who are being discharged from the hospital who now do not have the capacity to get up their front stairs and need a wheelchair ramp. Those things I think are more accessibly paid for, but not generally the overall redesign of the home.
Thank you, April. We just want to thank you again for presenting on fall prevention and providing so much knowledge on this topic. We have reached the end of our hour and it's time for us to wrap up. I'd like to thank our presenter, April, for being with us today. Thank you again. If you'd like to claim CEUs, of course, if you'd like to claim CEUs for today's webinar, you will be receiving a follow-up email by the end of the business day that will contain a link to the CEU application. That follow-up email will also contain a link to today's slides. Please note you have 60 days to claim CEUs for today's webinar. And please note it will take about 30 days from the date of your submission in order for us to process and issue your CEUs. Thanks for joining us today and have a good afternoon. Thank you.